Welcome to Review Central. This is Midwifery Reviewer number 6, featuring questions on obstetrics. Although this reviewer is specifically prepared for the Midwifery Licensure Examination given by the Professional Regulation Commission of the Philippines, the concepts are universal and are applicable to similar midwifery licensure exams given in other territories. There are 10 questions featured on this reviewer. All questions are modeled on actual questions that appeared on previous midwifery licensure exams. Let's begin. Question number 1. Fetal macrosomia is defined as an infant weighing A. Up to 3,000 grams. B. Up to 3,500 grams. C. Up to 4,000 grams. D. More than 4,000 grams. The correct answer is D. More than 4,000 grams. The term fetal macrosomia is used to describe a newborn who's much larger than average. A baby who is diagnosed as having fetal macrosomia weighs much more than 4,000 grams, regardless of his or her gestational age. About 9% of babies worldwide weigh more than 4,000 grams. Question number 2. The organ which is frequently injured during traumatic vaginal delivery of breech presentation is the A. Spleen. B. Brain. C. Liver. D. Heart. The correct answer is C. Liver. Breech presentation increases the risk of hepatic birth injuries, or injury to the liver. A study of 151 deceased newborns with traumatic subcapsular hemorrhage of the liver established a significantly higher frequency in the group of neonates that underwent breech delivery, 17.2%, than in the group with head presentations, 5.7%. Question number 3. A first-degree laceration of the perineum involves A. Anal sphincter. B. The fascial and muscles of the perineal body. C. Vaginal mucous membrane and perineal skin. D. All of these. The correct answer is C. First-degree tears or lacerations are the least severe, involving only the vaginal mucous membrane and the perineal skin, the skin between the vaginal opening and the rectum and the tissue directly beneath the skin. It may result to some mild pain or stinging during urination. Question number 4. The most common position for vaginal delivery is A. Dorsal lithotomy. B. Squatting. C. Sims lateral position. D. Trendelenburg position. The correct answer is A. Dorsal lithotomy. The lithotomy position is used during childbirth since it provides the doctor, or midwife, with good access to the mother and the baby. With this position, the mother lies on her back with her legs flexed 90 degrees at her hips. Her knees will be bent at 70 to 90 degrees, and padded footrests attached to the table will support her legs. When in the dorsal lithotomy position, a woman is putting direct pressure on her sacrum or tailbone, forcing it into a flexed position and making the pelvic outlet smaller. Question number 5. If the most dependent portion of the head is at the level of the ischial spines, the station is said to be A. -1. B. 0. C. +1. D. Cannot be determined. The correct answer is B. 0 station. This is when the baby's head is even with the ischial spines. The baby is said to be engaged when the largest part of the head has entered the pelvis. If the presenting part lies above the ischial spines, the station is reported as a negative number from -1 to -5. Question number 6. The cervix is fully dilated when it has opened about A. 8 centimeters. B. 12 centimeters. C. 10 centimeters. D. 6 centimeters. The correct answer is C. 10 centimeters. The cervix must be 100% effaced and 10 centimeters dilated before a vaginal delivery. The first stage of labor and birth occurs when the mother begins to feel persistent contractions. These contractions become stronger, more regular and more frequent over time. Question number 7. Fetal distress is suspected if the fetal heart rate per minute is A. 100, B. 130, C. 140, D. 150. The correct answer is A. 100 per minute. Fetal distress is defined as a heart rate greater than 160 or less than 120 per minute between uterine contractions, with or without meconium-stained liquor. Question number 8. The obstetric maneuver by which delivery of the head is facilitated is known as A. Creedy's maneuver, B. Rietgen's maneuver, C. Leopold's maneuver, D. Queen's Gambit. The correct answer is B. Rietgen's maneuver. The Rietgen maneuver is an obstetric procedure used by midwives and doctors in order to control the delivery of the fetal head. It involves applying an upward pressure from the coccygeal region to extend the head during actual delivery, thereby protecting the musculature of the perineum. Question number 9. The most common breech presentation is A. Frank breech, B. Incomplete breech, C. Complete breech, D. Jodhpur breech. The correct answer is A. Frank breech. Breech presentation is often determined by fetal ultrasound at the end of pregnancy. There are 3 types of breech presentation: complete, incomplete, and frank. Complete breech is when both of the baby's knees are bent and his feet and bottom are closest to the birth canal. Incomplete breech is when one of the baby's knees is bent and his foot and bottom are closest to the birth canal. Frank breech is when the baby's legs are folded flat up against his head and his bottom is closest to the birth canal. The frank breech presentation is the most common type of breech presentation, comprising 60 to 70% of all breech presentations. Question number 10. Transverse lie is more common in A. Grand multiparity, B. Nulliparous, C. Postmature gestation, D. Premature gestation. The correct answer is A. Grand multiparity. The baby is in a transverse lie if it is positioned horizontally across the uterus, rather than vertically. Although many babies are sideways early in pregnancy, few remain this way when labor begins. Transverse lie is more common in grand multiparity. A reasonable definition of grand multiparity is a mother who has had 5 or more births, either alive or stillborn, at 20 or more weeks of gestation. You have just completed Midwifery Reviewer number 6, which featured questions on obstetrics. If you wish to watch more midwifery reviewers on obstetrics, check out our Midwifery Obstetrics Reviewers playlist. Check out also our other Midwifery Reviewers playlists for other reviewer topics. If you haven't done so yet, please don't forget to subscribe to Review Central, and click or press the bell button, to make sure you get notified whenever we post a new reviewer, or other review materials on this channel. Please like if you find this video useful, and feel free to share to anyone who may also benefit from it. We wish you all the best on your forthcoming midwifery licensure exam.